In 1898, if your child had a cough, your doctor might prescribe a new miracle drug. It was called heroin. Yeah, that heroin. And it wasn't just available by prescription. You could walk into any pharmacy and buy it over the counter. No questions asked. This is the story of how one of the world's most dangerous drugs was marketed as a safe medicine for children, and how it took decades for anyone to realize the mistake. But first, why would anyone think this was a good idea? By the 1890s, America had a quiet crisis spreading beneath everything. Hundreds of thousands of people were addicted to morphine, many of them Civil War veterans, who had been treated for injuries and accidentally hooked for life. Doctors were desperate. They needed something as strong as morphine, but without the addiction. And that's when Bayer Pharmaceuticals stepped in. In 1897, one of their chemists, Felix Hoffmann, began experimenting with morphine in a laboratory in Germany. His mission was simple: create a safer opioid, something cleaner, something doctors could trust. He made 2 small chemical changes, just 2, and suddenly, morphine became something new, something faster, something stronger. Bayer named the compound diacetylmorphine, and they tested it on their own employees. The workers all reported the same thing. They felt heroish, heroic, invincible. Bayer heard that and immediately stopped thinking like scientists. They started thinking like marketers. If the drug made people feel heroic, then the name wrote itself. They called it heroin. And in that moment, they were convinced, completely convinced, that they had created a miracle. Bayer began testing heroin on patients in 1898. Doctors reported that it worked beautifully for coughs, colds, and bronchitis. Even better, nobody seemed to get addicted, at least not in the short trials Bayer conducted. Bayer announced their discovery with confidence. Heroin was a safe, non-addictive alternative to morphine. They didn't just market it as a painkiller. They marketed it as a cure for morphine addiction itself. Yes, you heard that correctly. Their solution to opioid addiction was a stronger opioid. Bayer launched heroin commercially in 1898, the same year they trademarked aspirin. But while aspirin was marketed to adults, heroin was pushed specifically for children. Advertisements showed mothers giving heroin syrup to coughing kids. The tagline? Heroin, the sedative for coughs. Pharmacies stocked it right next to cough drops and cold remedies. No prescription required. You could buy a bottle as easily as buying aspirin today. And doctors loved it. Medical journals published glowing reviews. One physician wrote, "Heroin has been used with success in cases of cough and bronchitis, particularly in children." Another claimed it was the safest and most effective treatment for respiratory ailments. Within 2 years, Bayer was exporting heroin to 23 countries. It became one of their best-selling products. For a brief moment, heroin was more popular than aspirin. Parents trusted it. Doctors prescribed it enthusiastically. And Bayer made a fortune. Everything seemed perfect, until it wasn't. By 1902, just 4 years after launch, some doctors started noticing something odd. Patients who had been taking heroin for extended periods were asking for higher and higher doses. When they tried to stop, they experienced severe withdrawal, sweating, shaking, nausea, pain. Doctors began writing cautious letters to medical journals. One physician noted, "After prolonged use, patients seemed to develop a dependence." But Bayer dismissed these concerns. They insisted heroin was non-addictive when used as directed. The problem, they claimed, was that patients were misusing it. But the reports kept coming. By 1906, the American Medical Association published a study suggesting that heroin might be even more addictive than morphine. Not less addictive, more. The very thing it was supposed to replace, it made worse. Doctors began pulling back. By 1910, medical opinion had shifted completely. Heroin was no longer seen as a miracle drug. It was seen as a disaster. In 1913, 15 years after launch, Bayer quietly stopped manufacturing heroin. They never admitted the mistake. They just stopped making it. But by then, the damage was done. Thousands of people, including children, had become addicted. And because heroin had been so widely available, it had already entered the black market. In 1914, the United States passed the Harrison Narcotics Act, restricting the sale of opioids, including heroin. By 1924, heroin was completely banned in the US. Other countries followed. The drug that was supposed to save people from morphine addiction had created an even worse crisis. So, what went wrong? 3 things: overconfidence, rushing to market, and a lot of money on the line. Bayer's trials were far too short. Heroin addiction doesn't develop in days or weeks. It takes months. By the time long-term users started showing signs of dependence, heroin was already on pharmacy shelves worldwide. Second, Bayer had a financial incentive to believe their own marketing. Heroin was making them rich. Admitting it was dangerous meant pulling a best-selling product off the market, so they ignored the warning signs for as long as they could. And third, there was a fundamental flaw in their logic. They assumed that because heroin was chemically similar to morphine, they could predict its effects. But small chemical changes can have massive consequences. Those two acetyl groups made heroin cross the blood-brain barrier much faster than morphine. That's why it felt more intense. And that's why it was more addictive. But Bayer didn't know that in 1898. And by the time they figured it out, it was too late. The heroin epidemic that began in the early 1900s never really ended. It just transformed. By the 1960s and 70s, heroin had become a major illicit drug. And then, in the 1990s, history repeated itself. Another pharmaceutical company created another powerful opioid, marketed it as safe. Doctors trusted them, patients became addicted, and the company denied everything. The pattern never changed. A company creates a powerful drug. They promise it's safe. Doctors trust them. Patients suffer. And by the time the truth comes out, millions are hurting. It's the same story, repeated a century later. The Bayer heroin disaster should have been a warning, but the lesson wasn't learned. Or maybe it was learned and ignored. Because there is a lot of money in selling powerful drugs. And as long as profit comes before safety, history will keep repeating itself. So, the next time a company promises a miracle cure with no downsides, remember what happened here. And if you think that's bad, wait until you hear about the army that got drunk and accidentally attacked itself. That story is just as ridiculous. Until next time.